Ask the HIV doc. Let's talk about care and treatment in HIV. Hello folks, it's Mark Medicals with the latest on HIV cure news, HIV treatment, symptoms of HIV, and HIV tests. Do you know why every person living with HIV should be on antiretroviral medications? How does taking HIV medicines help HIV-negative partners? Why should every HIV-positive person have undetectable HIV? And how long will you become undetectable after starting treatment? Do you know the possible side effects of HIV medications? Do you want to know what immune boosters that are recommended for people living with HIV? Which viral load is the best? Also, in this video, I will answer the following related questions. 1. How long does HIV treatment last? 2. How to remove HIV virus from the body. 3. How to cure HIV permanently. 4. What drugs are used to treat HIV UK? 5. What drugs are used to treat HIV in the USA? 6. When should you start HIV treatment? Alright, here we go. 1. How long does HIV treatment last? Once in your body, HIV breaks into cells of your immune system, also called CD4 cells. Once inside, the virus hijacks and uses the machinery of your CD4 cells to replicate into millions of new HIV copies. Some of the HIV lies dormant or silently while in your CD4 cells, and form what is called HIV reservoirs or pockets of hidden HIV. Another property of HIV that is different from other germs is that HIV integrates its genetic material into the human DNA system, and the two almost become one. Reasons why HIV cannot be cured is because of the hidden HIV and tightly integrated HIV with the human DNA. Your immune system nor HIV medications cannot reach or identify hidden or dormant HIV and thus cannot be eliminated. Your ARVs only eliminated the actively replicating virus. Viral load is the amount of actively replicating virus in your blood. At the end of the HIV replication cycle, the virus destroys the CD4 cell, leading to low CD4 cell counts. Normal CD4 cell counts should be any number between 500 to 1600. The role of HIV medications is to stop the active HIV from replicating but has no action against the dormant HIV. These medications should be taken for life because, if you suddenly stop taking your medications, your dormant HIV all of a sudden becomes active and starts replicating. By stopping HIV replication, your medications eliminate active HIV from your blood, leading to undetectable viral load. Everybody living with HIV should aim at having and maintaining the lowest or undetectable viral load, which is only achieved by taking your HIV medications consistently. 2. How to remove HIV virus from the body. People living with HIV have two classes of virus: the actively multiplying virus and the silent or dormant or hidden HIV. It is the active HIV that destroys your immune system and eventually causes AIDS. Fortunately, your ARVs and immune system eliminate this virus. On the other hand, the silent or dormant HIV causes no AIDS, nor destroys your immune system. Unfortunately, this virus cannot be eliminated from the body and is the reason why HIV has no cure today. Your antiretroviral therapy medicines only eliminated the active HIV, leaving your HIV reservoirs or hidden HIV untouched. At any time during your life, some hidden HIV gets activated and starts replicating. This is a reason you need to take HIV medications for life. 3. How to cure HIV permanently. Yes, HIV can be cured permanently. But how? If you can stop HIV from forming hidden HIV reservoirs, then your body or medications can eliminate it permanently. Studies have shown that after exposure, hidden HIV or dormant virus starts forming in your body within 1 to 3 days. PEP HIV medications or PrEP HIV medicines help to stop HIV from hiding itself or forming reservoirs. So HIV can be cured permanently soon after exposure and infection. You must take PEP immediately after exposure, or up to 72 hours after exposure, but the sooner the better. 4. What drugs are used to treat HIV UK? In the UK, HIV medications, HIV testing, and treatment monitoring are free of charge. Though most NHS services are operating on tight budgets, the choice of drug used should be because of effectiveness other than price. If 2 drugs are effective, the cheaper one is usually used by the client. Common pills used in the UK include Dovato, Biktarvy, cabenuva, Atripla, Genvoya, Triumec, Odefsey, Delstrigo, Eviplera, Strebild, and many others. 5. What drugs are used to treat HIV in the USA? There are noted variations in HIV treatment among different countries. This is because some medications are expensive and cannot be afforded by poor countries. Some of the examples of HIV medicines used in the USA include the following: Biktarvy, CimDuo, Symifi Lo, Symtuza, Delstrigo, Dovato, cabenuva, and others. 6. When should you start HIV treatment? We want to stop your HIV from forming many pockets of silent HIV. People whose immune system is severely worn out tend to have billions or trillions of hidden HIV. People with lots of hidden HIV normally have a higher viral load rebound after a few days of not taking HIV medications. There is this research study that found out that if a person begins taking HIV medicine immediately after infection, many people still keep their viral load low even after temporarily going off medications. This is because such clients have very few pockets of hidden HIV. To stop the formation of many pockets of hidden HIV, you will need to start on HIV medications very early after infection. Additionally, starting late may not help your immune system to repair itself to its full potential. The best way to treat HIV is to start antiretroviral medications soon after infection. This will keep your immune system strong and help you stay with undetectable HIV. You are said to be undetectable if you have less than 20, 50, or less than 200 copies of the virus depending on where you come from. People with undetectable viral load have zero risk of HIV infection to their partners, and also they have little to no risk of developing AIDS. Remember to eat a balanced diet and honor all your doctor appointments in a bid to monitor your progress on HIV treatments. Currently, HIV treatment is monitored by looking at your viral load and CD4 cell counts. The role of a good HIV treatment regimen is to increase CD4 cell counts to above 500 and to lower viral load to levels below 200, 50, or below 20 depending on the country you come from. I do not recommend using herbal medicine. Some herbal medicine could negatively affect your medications. Please seek the advice of your doctor before using herbal medicine alongside ARVs. Immune boosters like the ones I recommend in the description below this video can be used only after consulting your doctor. Today, there are many types of ARVs people take, and I may not know if yours will be negatively impacted by my recommended immune boosters. Common side effects of ARVs include nausea, skin rash, fatigue, trouble sleeping, weight gain, liver damage, kidney damage, and many others.